Mr. Abdul Samad.
Madam Deputy Speaker, it's difficult to speak after two doctors who are experts in their line. Nevertheless, I thank fellow NMP Dr. Tan Yua Som for allowing me to take part in the team raising this motion. As I represent the voices of the working people, there are two main areas that my speech will focus on, namely the welfare of healthcare workers and the challenges of enticing young Singaporeans to embark on a career in the healthcare sector. They are the future of our healthcare workforce. For the start, I would like to share with this House that the Healthcare Services Employees Union, HSEU, and the Singapore Manual Mercantile Workers Union, SMMWU, which represents nurses, allied health professionals, and support staff, collectively have a membership strength of more than 35,000 members. We call on those who are not members yet to quickly join the unions. The reason is simple. Unions will not just represent your voice at the workplace, but will also be your voice for a reason. While the healthcare industry is not within my purview, I have nonetheless reached out to the leaders of both HSEU and SMMWU to get their feedback on their members' concerns, challenges, and aspirations, both in the near and the long-term future. With the recent pandemic, we realize how much our healthcare workers are doing for Singapore behind the scenes. Indeed, the hours are long, and from time to time, they are on the receiving end of abuse by families of the patients. The question is, why should it only take a pandemic for us to realize the importance of healthcare workers? Why do we need a pandemic to learn how to appreciate them? Sadly, this is a reality of life. It is only in periods of crisis that we know the importance of these frontline workers. Just like myself in the power industry, it is only when there are tariff hikes or power failures we start to realize the importance of a stable and reliable power supply that we have taken for granted in our daily lives. Don't be ashamed to deny this reality in this real world. Madam, this House debated quite at length last year on the topic of Healthier SG. Many good suggestions and ideas were proposed by all in this chamber for us to remind ourselves on leading a healthier lifestyle. While the focus was on developing a healthier lifestyle, we should not forget the efforts of those who help us to develop healthier lifestyles, namely our healthcare workers. Let us be aware of the challenges faced by the healthcare workers, including those by our administrative and support staff, not just doctors and nurses who are facing patients directly. Let us not forget the equally critical roles of those supporting at various other departments like radiology, pathology, and more. This then brings me to focus on the welfare of healthcare workers now and preparing the future generation to serve in this industry. Prior to this sitting, I reached out to not just the two unions, but also cousins, friends, and my network, as well as fellow Singaporeans who observe firsthand the hard work of our healthcare workers. We acknowledge that while the ministry has done in their part to better support this group of workers via the hospital's management, there are still areas that can be further improved, like shift work, wages, and more. I would like to touch on shift rosters, and in fact note that the ministry has repeatedly stated that it does not regulate such rosters and leaves the same to the hospital management team. Accordingly, I appeal to the ministry to really have a team to observe independently the shift rosters that healthcare workers are assigned. Let us not wait until an unforeseen incident happens before we start to investigate. We need to ensure that shift rosters pay close attention to rest time in between, as we need physically alert workers at all times to attend to patients and supporting doctors. I feel strongly for this because my daughter is one of the thousands of healthcare workers. I have witnessed firsthand the long working hours that she had to go through during her past tenure at Sengkang Hospital. Sometimes I feel it's not about the corporate shift policy, but the line managers who plan the rosters that may be biased toward their preferred choice of workers. She left recently and shared with me also that about half of her colleagues in the same team also left much earlier. She's now embarking on a new journey at a new workplace. Ironically, prior to that, she was an intern in that same hospital in 2020 during her final year of studies in Republic Polytechnic. I was shocked then to hear that she received zero allowance during her internship. I didn't raise this flag earlier as I was still doing my checks with my close friends within the sector. While doing my checks, I then recalled this same issue was raised many years earlier at some dialogue sessions. And incidentally, my daughter also suffered the same fate. I would like to ask if MOH is aware of such situations whereby interns are not compensated for their labor. Let us not paint internships like another day at school. It is not and never will be the same between academic and work experiences. I don't think it will cripple the hospitals or MOH finance to grant an allowance to these students as they are working in the real world, not in school. I call on Ministry of Hospitals to review this immediately and not make our students subject to free labor. Let us not make our children the workforce of the future as a source of free labor for today. We should not be perpetuating such practices. Sir, as Singapore, Madam, as Singapore builds more restructured hospitals across the island, that means there will be more job opportunities. This will also mean healthcare workers may be able to relocate to their preferred hospitals near their homes, or even get better pay, or even both. Are we prepared for the pipeline of Singaporeans wanting to work in this healthcare sector, especially the young ones? While we remain open to foreign healthcare workers to supplement our resident workforce, what are the steps in place to ensure that we have sufficient Singaporeans to be the core of our healthcare workers? The above concern also represents a few of many concerns that were shared with me by my fellow brothers and sisters in the unions. While much have been said for those at hospital, let us not forget the healthcare workers at our neighborhood polyclinics. The stress that they face at work is equivalent to those working at hospitals. Based on my interaction, some have highlighted that they hope polyclinics operate strictly on appointments as they still see many walk-ins even when appointments are already full. This really stretches them and even the doctors there. Separately, there are those that hope that polyclinic operations can soon be reduced to a 5-day work week upon review of operating hours. On a lighter note, I do understand the ongoing tripartite efforts around the protection and prevention of abuse and harassment of our fellow healthcare workers. More severe action must be taken against any such abuse, regardless of the magnitude, towards our healthcare workers. Please allow me to speak in Malay. Dalam perjalanan kita membuat persiapan kepada rakyat yang lebih menua, guna meningkatkan rancangan kesihatan kita yang juga termasuk pekerja jagaan kesihatan. Melengkapi pekerja masa kini dengan pengetahuan dan kemahiran baru adalah penting, memandangkan terdapat permintaan pekerjaan dan kekurangan tenaga kerja. Kita perlukan pekerja jagaan kesihatan yang terlatih dan prihatin untuk memantau dan menjaga rakyat Singapura yang semakin menua, baik di rumah hospital maupun di rumah rawatan masyarakat. Pekerjaan ini memerlukan bukan saja kekuatan fizikal, tetapi juga kekuatan mental apabila berhadapan dengan pesakit yang sukar dan ahli keluarga yang mencabar. Seperti mana dalam ucapan bahasa Inggeris saya tadi, cabaran masa lalu, sekarang dan masa hadapan akan dihadapi kita semua. Kalau maklum bahawa terdapat 2 kesatuan sekerja iaitu HSEU dan SMMWU yang mewakili anda untuk mendengar dan bercakap bagi pihak anda tentang perihal cabaran di tempat kerja. Sertailah mereka sekarang dan janganlah anda berlengah. Kesatuan Sekerja anda tahu tentang cabaran di tempat kerja anda dan akan berusaha sebaik mungkin untuk menyokong kepentingan anda dari segi tempat kerja sehinggalah memperuntukkan faedah kebajikan yang lain. Janganlah malu untuk memberi maklum balas kerana saya tahu bahawa rakan-rakan Kesatuan Sekerja saya akan sentiasa berada di sisi anda. Di antara cabaran ialah waktu bekerja panjang bagi golongan bekerja shift, keletihan akibat waktu kerja tambahan, pesakit dan penjaga yang suka mendesak dan gaji yang selaras dengan beban kerja bukan hanya semasa krisis. Saya merayu kepada Kementerian Kesihatan untuk benar-benar meneliti waktu bekerja shift di hospital dan tidak menunggu sehingga satu kejadian yang tidak diingini berlaku. Gesaan ini telah dibuat beberapa kali oleh anggota parlimen di Dewan ini dan saya harap ia tidak akan dipandang ringan. Satu lagi perkara yang membimbangkan ialah pelajar latihan amali di hospital tidak mendapat sebarang allowance tetapi melakukan kerja yang serupa dengan kaki tangan yang boleh disifatkan sebagai buruh percuma. Saya pernah suatu ketika meragui amalan sedemikian pada masa lalu apabila saya mendengarnya. Tetapi ini menjadi kenyataan apabila anak perempuan saya sendiri mengalaminya ketika dia melalui latihan amali di Hospital Sengkang pada tahun 2020. Maka itu, saya menyeru institusi pengajian tinggi dan Kementerian Kesihatan untuk mengkaji semula amalan ini dan tidak membenarkan buruh percuma diamalkan di Singapura. Amalan di atas jika tidak diatasi, boleh menghalang golongan muda Singapura daripada menyertai sektor yang bermakna ini. Kita memerlukan lebih ramai golongan muda. Kita memerlukan lebih ramai golongan muda Singapura untuk menyertai sektor ini sebagai persiapan kita bagi penduduk yang semakin menua. Hospital-hospital baru dibina dan mereka menghargai usaha saudara-saudara Kesatuan Sekerja saya dari HSEU dan SMMWU untuk bekerjasama dengan rakan pengurusan untuk meningkatkan kemahiran anggota dan pekerja mereka untuk mod kerja hari ini yang lebih maju dan bersedia sedia untuk masa depan. Tolong pastikan bahawa bila pekerja kita yang telah menjalani latihan akan mempunyai gaji yang lebih baik dan prospek kerja yang jauh lebih baik daripada sebelumnya. Once again, I call on the relevant parties to remind ourselves about the importance of this group of healthcare workers and doctors and never be shy to appreciate and say thank you to them whenever you visit hospitals, both restructured and private, polyclinics and even neighborhood clinics. On behalf of all my fellow leaders from the labour movement, we would like to thank you for your efforts to look out for our families, friends and fellow Singaporeans. Once again, don't forget to join the union because for the union, members first, workers always. Madam Speaker, I support the motion.